Good day, my audience. You're welcome once again to this channel, Dr. Fred Academy. Today we shall be looking at the muscles of the hind limb. That is the muscles that attach the hind limb to the trunk or the pelvic girdle of the animal. Okay, these muscles attach the entire hind limb to the trunk of this animal, and we shall be concentrating on this species, that is the canine species, the dog. So we shall start with the muscles of the coxofemoral joint, that is muscles that act on the coxofemoral joint or the hip joint. These muscles are, topographically they are divided or classified into four. The first one is a gluteal group of muscles. The second one is the deep group of muscles. The third one is the medial group of muscles, and then the fourth one is the caudal group of the coxofemoral joint muscles. So we shall start by looking at the gluteal group of muscles. The gluteal group of muscles has three muscles that form it. So the first one is a superficial gluteal. Okay, so here we have the superficial gluteal. Okay, we'll lift up the biceps femoris. So this is the superficial gluteal muscle. Okay, slightly covering the middle gluteal. Okay, this is the middle gluteal muscles. Okay, the middle gluteal muscles. Okay, slightly covered by the superficial gluteal. Okay, so if we lift up the superficial gluteal, we'll see the entire middle gluteal. And then if we cut open the middle gluteal just at the middle of it and lift it up, we'll find the deep gluteal. Okay, when you come closer, you find the deep gluteal. Okay, so this is the deep gluteal muscle, the deep gluteal. Okay, let's look at them again. The superficial gluteal, the middle gluteal, which when cut, okay, this is the middle gluteal. We'll cut it at the middle and lift up, we'll find the deep gluteal muscle. All right. Okay, so the next one we shall be looking at is the deep group. Okay, this deep group of muscle include generally they include the Quadricep Femoris and then the Piriformis, but the Quadricep Femoris is only present in the cats. Okay, so but we will see the Piriformis. The Piriformis is here just equally when we lift up the, of course this is the middle gluteal. When we lift it up, okay, we'll find the Piriformis. Okay, just close to the deep gluteal. So this is the Piriformis. Okay, this is the Piriformis, just on the caudal border of the deep gluteal. All right, so this is the Piriformis. Okay, this is a Piriformis muscle. All right, while this is the caudal gluteal. Okay, so having shown you the deep group, let's look at the medial group. All right, on the medial group, of course, as the name implies, we need to go to the medial aspect of the hind limb, and this group include we have first of all we have the Sartorius. Okay, in this species the Sartorius has two bellies. That's the cranial belly, okay, and the caudal belly. All right, the cranial belly, okay, and the caudal belly. All right, that is Sartorius. Okay, the next one we have is the Pectineus. All right, this is a Pectineus. It's a very small muscle. Okay, there's a Pectineus. The Pectineus is here. All right, This is the Pectineus, okay? This is the Sartorius, cranial belly, caudal belly, and then the Pectineus, okay? So this is the Pectineus here. And then the next one is the gracilis, okay? This is the gracilis, all right? The gracilis. And then the third one is the adductor, okay? This is the adductor. We want to see it fully, we lift up the gracilis and we see the adductor fully, okay? So this is adductor muscle, okay? So let's take it again. This is the Sartorius, okay? The cranial belly, the caudal belly. This is the Pectineus, all right? This is the adductor, and then this is the gracilis, all right? Okay, this now is the medial group. We talked about the gluteal group. We talked about the deep group. Now we just finished with the medial group. So let's talk about the caudal group. The caudal group of this muscle, the caudal group here include, they are known as the hamstring muscles. Of course, ham means the back of the thigh, okay? Ham means the back of the thigh. And the muscles here are just three of them. We have number one, the biceps, okay? This is the biceps brachii. Sorry, biceps femoris, okay? All right. This is the biceps, okay? The biceps femoris, okay? So this here is the biceps femoris, all right? Of course, this is the popliteal lymph node, okay? The popliteal lymph node. So this is the biceps femoris. Let's get it from the lateral side again, okay? This is the biceps femoris, all right? And then let's take it up, okay? And then the second muscle is that's the second muscle of the caudal group, is the semitendinosus, okay? This is the semitendinosus, okay? And then lastly, the semimembranosus has been cut. We just cut it to, you know, show some other muscles, okay? Shall come to that. So let's take it again. We say the caudal group includes the biceps femoris, okay? There's a most lateral muscle of the hamstring group, okay? So when it is lifted up, going medially, we have the next one, this, which is the semitendinosus, and the last one is the semimembranosus, okay? Don't forget that this is the gracilis. We already mentioned before that this is part of the medial group of the coxofemoral muscles, okay? So this is all of the muscles that act on the coxofemoral joint. Remember, we said they are made up of four groups: the gluteal group, the deep group, the medial group, and the caudal group. Okay, so having said this, let's look at the muscles that act on the stifle joint. Okay, this is the stifle joint, or the knee joint. All right, so we want to look at muscles acting on this joint. Basically, here we have two classes of muscles, that is the extensors and the flexors. Okay, the primary extensors here include the quadriceps femoris and the biceps femoris. So now let's look at the quadriceps femoris. Okay, the quadriceps femoris includes the following. Okay, because of course it has four heads from the name quadriceps, that is four heads. Okay, it has four heads. The heads include the rectus femoris, the vastus lateralis, the vastus intermedius, and the vastus medialis. So let's look at these four heads. Let's look at these four heads. Okay, like I said, let me take it again. I said the muscles or the four heads of the quadriceps femoris include the rectus femoris, the vastus lateralis, the vastus intermedius, and the vastus medialis. So let's look at these heads. The first one is the vastus lateralis. This is the vastus lateralis, just in at the cranial border of the biceps femoris. This is the vastus lateralis. Of course, it is covered, by the tensor fascia lata. Okay, this is the tensor fascia latae, okay, which covers the vastus lateralis. So we leave this up to properly see the vastus lateralis. So this is the vastus lateralis. Okay, now here we have the vastus. We lift up the, of course, on this medial side we need to lift up these two bellies, okay, of the Sartorius. Okay, these are the two bellies of Sartorius. Okay, so we need to lift them up. Okay, of course, this is the original position. Okay, so we lift them up. This is Sartorius, both the cranial and caudal belly. So this is the vastus lateralis. Okay, vastus medialis, sorry. Okay, vastus medialis. And then, of course, we said earlier on, this is the vastus lateralis on the lateral side. Okay, while on the medial side we have the vastus medialis. Now, in between the vastus medialis and the vastus lateralis, we have the rectus femoris. Okay, this is the rectus femoris. Okay, as you can see, the rectus femoris is in between the vastus medialis and the vastus lateralis. Okay, now the fourth head is the vastus intermedius. Okay, now having cut the rectus femoris at the point, we can lift it up. Okay, when it is lifted up, just inside, okay, what we have here is the vastus intermedius. Okay, so this is vastus medialis, vastus intermedius, vastus lateralis. Okay, vastus lateralis, and then of course this is the vastus, the rectus femoris. Okay, all right. Now the next one is the biceps femoris. Okay, like we said, this is the biceps femoris here. Okay, the biceps femoris. Okay, down here is the sciatic nerve. Okay, the sciatic nerve. Okay, the sciatic nerve. All right. So I take it again, the muscles, the extensor group of muscles, okay, that act on the stifle joint include the quadriceps femoris and the biceps femoris. And the quadriceps femoris include or are made up of, or has four heads, and the heads include the vastus lateralis, the vastus medialis, okay, the rectus femoris, and then the vastus intermedius. Okay, and then this is the biceps femoris. Okay, the biceps. So let's look at the flexor. Okay, the flexor muscle here is the popliteus. Okay, the popliteus or the popliteal muscle. Okay, when we go through the medial surface of this limb, we'll get to see it very well defined. Okay, so this is the popliteus. Okay, this is a popliteus. Okay, very clearly, well attached to the proximal aspect of the tibia. Okay, the tibial bone. Okay, so this is a tibia. So this is a popliteus. Okay, all right. Now let's look at the muscles that act on the tarsal joint, the tarsal and then digital joint. So these muscles here act on the tarsal joint and digital joint. Okay, so these are the muscles of the tarsal and digital joint. Here we have two groups of muscles. They include the flexors and the extensors. Okay, the extensors, okay, actually, okay, let's look at it this way. Okay, let's take it this way. The group of muscles here, or the muscles here, have two major groups. That is the cranial group and the caudal group. Okay, because this is the tibia is here. Okay, we have the tibia. Okay, so those in front of the cranial surface of the tibia are called the cranial group, while those on the caudal surface of the tibia are called the caudal groups. Okay, now take note that these ones that are at the cranial surface of the tibia, that's the cranial group, they function to flex the tarsal joint and extend the digit. Okay, they function to do what? Flex the tarsal joint and extend the digit, while the caudal groups, they function to extend the tarsal joint and flex the digit. Okay, all right, so let's look at the muscles. The muscles here, that is a cranial group of muscles here, include the tibialis cranialis. Okay, that is the cranial tibia. Okay, this is the tibialis cranialis muscle. The second one here is the long digital extensor. Okay, long digital extensor. The third one here is the peroneus longus. Peroneus longus. Okay, and then we have a fourth one here, which is called the Peroneus Brevis. Okay, Peroneus Brevis. So these four make up the cranial group. That is the group that flex the tarsal joint and extend the digits. And I take it again: the tibialis cranialis or cranial tibia, long digital extensor, peroneus longus, and then finally the peroneus brevis. Okay, the peroneus brevis. Let's look at the caudal group. The caudal group here include the gastrocnemius. Okay, this is the gastrocnemius here. Okay, and then secondly we have the superficial digital flexor, and then finally we have the deep digital flexor. Okay, I take it again: gastrocnemius, superficial digital flexor, and deep digital flexor. Okay, when you come to the medial side, you will still see the muscles appearing in a similar fashion. Okay, because here we have the gastrocnemius. All right, like I said, this is the gastrocnemius. Of course, this is the medial surface or aspect of the hind limb. This is the gastrocnemius. This is superficial digital flexor. Okay, superficial digital flexor. All right, and then thirdly, the deep digital flexor. Okay, and of course, the proximal aspect of the tibia is where we have the popliteal. Okay, the popliteals. Okay, all right, this is the tibia. Okay, this is a common calcaneal tendon. Okay, sometimes it is called the Achilles tendon in humans. Okay, Achilles tendon. Okay, the tendon is attached to the calcaneal bone. Okay, the calcaneal bone. All right. Okay, thank you very much for your audience. Okay, thank you for listening. Thank you for your audience. I want to advise you, as usual, to subscribe to this channel, Dr. Fred Academy. and do well to click on the notification bell icon. This is very important, because if you do that, you will surely get notified whenever we post videos. Okay, don't forget to like our videos, do well to share to others, and then make sure you comment. Thank you.